When we talk about histamine and the antihistamines, there's actually 4 different histamine receptors. So your body secretes histamine for various reasons, and it will bind to all 4 of these receptors when it needs to. But because we are a group of enlightened medicinal chemists, we have created molecules that selectively bind to 2 of the 3. So there's histamine 1, 2, 3, and 4. And we have medicines that bind to histamine 1 and histamine 2. We don't have any that bind to histamine 3 and 4 because we don't know what histamine 3 and 4 even do. There's no clinical benefit of binding to histamine 3 or 4. So today we're going to look at, honestly, most of the available chemicals. There's only a few missing because they need a prescription or if I just don't have it. But we'll start, we'll get this one out of the way quickly. And by quickly, I mean we'll spend a lot of time on this. This is probably the most common first-generation antihistamine. Okay. Now, that sentence I just said really was not very descriptive. What does that even mean? Whenever we say antihistamine, we are virtually always talking about histamine 1 receptors. These are the receptors that play a role in like vascular permeability. This is what we would want to block if we were having allergies. Now, of our medications that bind to the histamine 1 receptor, because there are many, we actually divide those into 2 different categories. First generation and second generation. Okay, so here you have histamine 1, 2, 3, and 4. Of histamine 1 blockers, there's first generation and second generation. For 2, 3, and 4, well, we don't have any that touch 3 or 4, but for 2, we don't have generations. And if we do, it's not a popular term. This is probably the most common first-generation antihistamine. And to be specific, I'm talking about histamine 1. And it is Diphenhydramine, also known as Benadryl. Now, what's the difference between the first generation and second generation antihistamines that bind to a histamine 1 receptor? First generations, the molecules are lipophilic enough, meaning that they will pass through a semi-permeable membrane. If something is lipophilic, think like oil. Maybe that's not, actually that's a great term because oil is just, I think, like carbon, chains of carbons. And if you were to look at the structure of any first generation antihistamine, there would be more carbons in it than, for example, a second generation antihistamine. I know that was a lot to take in, but bottom line is this passes through what's known as the blood-brain barrier. It's like a place that separates your brain from the rest of your body. And it can do that because the structure is lipophilic enough. I I want to take a moment to maybe correct myself slightly. Lipophilic and hydrophilic, it's the ratio that matters. It's not really that this is lipophilic enough to get through the blood-brain barrier. It's the ratio between lipophilic and hydrophilic. This is diphenhydramine. Now, that makes sense because a common side effect is it can make you drowsy. I want to add one more thing to our blood-brain barrier discussion. The molecule also has to be small, and it has to not have a charge. So diphenhydramine meets all those requirements. So it'll go into the brain and modulate the H1 receptors in the brain. Additionally, this is not a perfect molecule. It will interact with other receptors. And it also blocks acetylcholine. Acetylcholine is a neurotransmitter that plays a number of roles, some of which have to do with secretions, and thus I have the professional opinion that a first generation, although it can make you drowsy, might possibly be better for any sort of allergy symptoms like a runny nose, because this anticholinergic side effect can help dry up those secretions, or stop them rather. Additionally, there is a hypothetical risk for developing dementia with long-term use of anticholinergic medications, of which this is one. We call it an antihistamine, but it is also anticholinergic. I often wonder, when our chemists were developing these molecules, did they have a debate? Were they locked in a room somewhere secret? And they said, all right, are we going to call this an antihistamine or an anticholinergic medication? Lots of medications have lots of different mechanisms of action. That is why we have side effects some of the time. We can explain some of the side effects with other mechanisms that the molecule may have, which is very much the case for this one. Dry mouth, you could also experience. There are lots of very many hallmark symptoms of blocking acetylcholine in the brain. Now, the point about dementia, you would have to take this for, I believe some of the studies I saw were like 3 or 6 months consistently. But realistically, it would have to be like 5 years before there's even an increase in the risk for dementia. And that risk is very slight. And depending on who you ask, it's inconsequential. It is, quite frankly, statistically irrelevant, but there are better options for allergies. The one exception, and then this is just my professional opinion, is allergies that have a lot of secretions. This is where I would reach for a short-term use of an first-generation antihistamine. But this is not a useful or a useless molecule. This is very important for treating something called dystonia. And dystonia is when your muscles just kind of freeze up. It's a side effect of antipsychotic medication. What happens is whenever we give someone an antipsychotic medication, it blocks dopamine receptors in the brain, which is what we want. If you want to be if you want to oversimplify what what schizophrenia is, it is having too much dopamine. But when you block the dopaminergic activity in the brain, you also create an imbalance between dopamine and acetylcholine. So if you could imagine for one moment, here is dopaminergic and here is cholinergic activity in the brain. I honestly don't know if they're supposed to be equal or not, but let's just say for this experiment they are equal. When you give someone an antipsychotic, it stops the dopaminergic activity. Or I guess dims it, rather, I should say. That's okay. But if things get really, if there's a huge disparity between the dopaminergic and cholinergic activity, then you can develop something called dystonia. And when that happens, all you have to do is equalize the level. So you could give someone dopamine and bring it back up, but then that defeats the point. You're trying to block dopamine to begin with. Or you could block some acetylcholine and bring the level down to the dopamine level. And that's what this does. So if somebody's on an antipsychotic and their dopaminergic activity is low, simply give them some diphenhydramine, and the dystonia dissipates. The point I'm trying to make here is that although I agree that in most cases there are better medicines for allergies, this is not a useless molecule. It's very important. With that information in mind, diphenhydramine is ubiquitous. There's so many different preparations in all of the first generation antihistamines as well. Here's one that I got from Dollar Tree. Diphenhydramine 25 milligram. Now the dose can be as low as 12.5 milligram for kiddos and as high as 50 milligram for sleep for adults. Remember, this crosses the blood-brain barrier. It blocks histamine in the brain. And an unintended side effect if you are trying to treat allergies is that you would become drowsy. But if you're trying to go to sleep, then the side effect becomes the actual intended effect. Another thing I want to point out is that the anticholinergic effect, depending on who you ask, also creates a drowsiness feeling. In fact, it may actually be more of the anticholinergic effect that keeps you drowsy than it actually is the histaminergic effect past the blood-brain barrier. That depends on who you ask. but for certain, this will make you drowsy. And your nose will be very, very dry. Spirit Pharmaceuticals, Ronkonkoma, New York. They're blue so that you can go to sleep. The thing about diphenhydramine is that it comes in so many different preparations. These are both from the Dollar Tree. Let's take a look at these liquids. You see here it says 12.5 milligram diphenhydramine. That is not enough information. You have to know the concentration when we're talking about a liquid. So the only way to figure that out is on the back. And here it says diphenhydramine 12.5 milligram per 5 ml. Meaning, this is designed for little kiddos. This actually had a little cap, I don't know what you call it, little cup. And you could pour out 5 ml into the cup to give to the little kiddo. And each 5 ml has 12.5 milligrams of diphenhydramine. That would be like taking a quarter of a tablet of this. It's the same active ingredient. And once you pour this into the little kiddo, it gets absorbed in the GI tract. And these diphenhydramine molecules swim all around, blocking histamine 1 receptors. And then that does it both in the brain, crossing the blood-brain barrier, and also in the body. Now, why would you want to do that? Well, as I mentioned earlier, the anticholinergic effect would lessen a runny nose. But when your body experiences an allergic reaction, when allergens or sometimes other medications enter your body does a lot of things. One of them is it releases histamine. Remember, histamine promotes vascular permeability. That's where you get like redness. You know, if you have a reaction, you may get a rash or swelling on your skin. That's the redness, the vascular permeability. And most of the time, that's a good thing. It's your body's way of defending against an allergen. But sometimes your body overreacts, and we want to stop that. So that's where that comes in. Also, I just wanted to mention here, there's no alcohol in this one. Now this one, the Easy Night Sleep Aid. This is diphenhydramine 50 milligram. This is designed for adults to sleep. If you look down here, it does contain 10% alcohol. There are regulations for how much alcohol can be in liquids. For kids, you actually can have some alcohol, but after a certain age, I think it's like, I don't remember what it is off the top of my head. But this is an alcohol-free version for kids, basically. And it's a different concentration. When we look here, this is 30 ml, or I'm sorry, 50 milligram per 30 ml. Okay, this is 12.5 milligram per 5 ml. So let's count that out. 5, 10, 15, 20, 25, 30. So there's a lot more in this one per ml. Why do they do that? I'm not really sure, honestly. I think everything should be expressed in the same way. I see healthcare professionals mix this up all the time. So this is actually more concentrated. Yes, you heard that correctly. The kids version is 2.5 milligram per 1 ml. And the adult version is 1.6 milligram per ml. A common, I guess, logical error I see people make is they like things like super concentrated, and it binds to the receptor stronger. It has more affinity to the receptor. I don't care. No one cares. Anyone who knows anything about medicine could really care less how concentrated something is. Let me rephrase that. We don't get excited when we see something that's concentrated. We don't care how strongly it binds to a receptor, because we dose things correctly with those in mind. So yes, this is stronger, but you're taking much less. And if I were adult and I wanted to take this, I would just take 10 to 40 ml, or 10 to 20 ml, to get the appropriate milligram dose. I see this a lot. I presume they're mostly children, and they'll say like, "Oh, it's super concentrated." They'll say that in the comments or whatever of my videos, and I mean, I don't know. It's just such a ubiquitous, friendly phrase. Now, why does this contain alcohol? Per the FDA, alcohol is a solvent that is allowed to be in liquid preparations to help things dissolve. I don't think that's really needed, and this is why. We already have a preparation that is more concentrated, and it doesn't have alcohol. So truthfully, I think this is here just because they can. Now, you want to see something really crazy? Hold on to your hats, baby. This is another first-generation antihistamine. Diphenhydramine. Gravol. For whatever reason, Gravol is not very common in the United States. The brand name, I mean. The most common, I think, is called Bonine. No, I think it's Bonine Original or something like that. It's very confusing. Very confusing. Oh no, it's Dramamine. But it's very confusing because there's Dramamine Original, and then there's Dramamine Less Drowsy. Like, that's the actual name of the products. Kind of like Ross Dress for Less. It's so frustrating to me. Anyway, dimenhydrinate is actually a diphenhydramine molecule tagged, chemically tagged to another molecule, and if I recall correctly, it's a caffeine-like molecule. So this is said to have some or less drowsiness because the caffeine-like molecule kind of like counteracts the drowsiness of the diphenhydramine portion of this molecule. Isn't that crazy? Now you may notice here it says nausea and vomiting and dizziness, but I've never heard of Benadryl being used for nausea and vomiting. You may be thinking to yourself, well, you heard wrong. The FDA does not allow folks to advertise diphenhydramine as a nausea and vomiting dizziness medication, but it can be used that way. All first-generation antihistamines, because of that anticholinergic effect, can help with nausea, vomiting, vertigo type stuff. That's true, but you will never see anybody use diphenhydramine for such a thing because everyone associates it with allergies. What do you mean? Why are you giving me an allergy medication? I have nausea. It's just too much to explain to anyone. But here, this whole time, this was just diphenhydramine in disguise, and no one ever knew it. Here's another one. Unisom. Doxylamine. First generation. Sedating, crosses the blood-brain barrier. This is used for sleep. Could you use this for allergies? Yep. Yes, you could. But it does not have the FDA labeled indication for that. Now, what's the difference between these three? No one knows. The structures are different. The mechanism is the same. Why do we have so many? I don't know. It's just the world we live in, folks. Here's another one. Pyrilamine. This is a weird, I shouldn't say weird, it's just very uncommon. First generation. Sedating, crosses the blood-brain barrier, although somebody tried to tell me one time that doesn't. It does. This is this is used, I believe, for allergies, right? It just says antihistamine here. That's interesting. I thought it had to say what it's actually used for. Does this say antihistamine? See, this is nighttime sleep aid here. Here's another one, triprolidine. Now this is very potent. Again, I don't care because we dose things correctly. I could really care less how potent something is. I'm going to give you the correct dose with that. And yeah, I guess I should have said, I care how potent something is, but only for me to give you the right dose. Just because something is more potent doesn't make it better. It doesn't make it work stronger. The dose is what matters. So you only take 2.5 milligrams of this guy, triprolidine. This is a little dropper. Like, these other ones, this is also a liquid, but you only take 2.5 droppers full. Very, very potent. But you've never seen this before. Wait, this is also triploidine. But this is in combination with Sudafed, which is a vasoconstrictor. It doesn't have anything to do with the the histamine receptor. Oh, we love that reflection. Look at this. Chlorcyclazine. Bet you never heard of that one. Again, Sudafed vasoconstrictor. It's not an antihistamine. So look at all these are all first generations. And the one I'm missing is meclizine. And honestly, there may be another one or two here. So remember, these are first generation histamine 1 blockers. They have anticholinergic side effects, which can reduce a runny nose. And they cross the blood-brain barrier, which can make you drowsy. Now, when we move into the second generations, there are far less. This is loratadine. The brand name is Zyrtec. This is a second generation, also known as a non-sedating histamine 1 blocker, antihistamine. Remember, we're still talking about histamine 1 receptors. This does not cross the blood-brain barrier. Why? I don't know exactly because I didn't look it up, but it's either because it's less lipophilic, more hydrophilic. It has a charge on it, which I don't think is probably the case. Or the molecule is too large, which I also don't think is the case because I've seen the structure of these. So it more than likely is less lipophilic than the first generations. You do not see as much of an anticholinergic effect. In fact, it's safe to say there is no anticholinergic effect. Now, does some of this cross the blood-brain barrier and interact with an histamine receptor and cholinergic receptors? Probably some of it does. Probably some of it. But we, as a medication community, have decided that we label this as non-sedating, doesn't cross the blood-brain barrier, no anticholinergic effect, even though there's probably some of that happening. Now, there's a very important part I forgot to mention. Okay, if we look at this pyrilamine, remember this is a first generation. Look at the dosing. What's it say there? 1 tablet every 6 to 8 hours. When we're talking about allergies, the first generations, here, let's look at this one too. Does this even come off? Look, every 4 to 6 hours. Now this is for diphenhydramine. When we talk about first generations, they do not last very long. Now, everybody likes to get up in arms about half-life. I don't care about half-life. Anyone who knows what they're talking about doesn't care about half-life. Why? Because we dose it correctly. Could really care less. And you know what? Sometimes the half-life doesn't even make sense with how frequently we give things. There are lots of examples. Common mistake I see folks outside the medicine community make is they go attached to a half-life. Don't care. Don't care. Duration of action is not the same as half-life. There are more factors at play. Now, is half-life a good rule of thumb? Well, yeah, absolutely. It's a good way to guide your thinking. But anyway, the first generations don't last as long. Now, if I look at this dosing, what's it say here? 1 tablet every 24 hours. Second generations last longer. That difference is the most important, I think. Truth be told, the sedating effects of the first generations, I'm a normal, healthy person. I don't care. It's really not that big of a deal. For some people, it can be. But what definitely matters is how long something lasts. Now, quiz. If someone has a dystonia, if they are experiencing dystonia, would this help them? Probably not. Maybe a little bit, but probably not. Because this doesn't have the anticholinergic activity, or not as much. So somebody experiencing dystonia would not be helped from this. Now, if somebody was having a rash on their arm, some sort of allergen, or they touch something that was causing their skin to react, would this help them? Theoretically, yes. Although I can guarantee in almost every situation a doctor is going to prescribe Benadryl, but theoretically, yeah. Because this does not cross the blood-brain barrier. It stays in the periphery. And that's where the reaction is taking place. Loratadine is not quite as recommended by the guidelines as Cetirizine. The guidelines say Cetirizine is slightly, ever so slightly more recommended because it has, I believe, less of an anticholinergic effect. You may want to double check me on that one, but I do know that Cetirizine is just ever so slightly more recommended than Loratadine. The reason behind it, I don't quite remember. These are both H1 histamine 1 receptor blockers, but they last longer. They don't cross the blood-brain barrier, or at least not as much. And they don't block histamine, or choline, acetylcholine. They do block histamine, that's what they're there for. This is a capsule, which is kind of weird. Here, this is Loratadine. This is just another type of Loratadine. Now, what's missing here? Levocetirizine, which is the pure form of Cetirizine, Cetirizine is something called a racemic mixture. And levocetirizine is just the active form, basically. Which sounds nice, but similar to what we were talking about earlier with the potency debate and the half-life and everything, I don't care. I don't care if something is a purified racemic mixture or not, because you know what? We use the correct dose. If you look at a box of levocetirizine, it will be 5 milligrams. Cetirizine is 10 milligrams. That is intentional. This is the racemic mixture. It has the inactive enantiomer in it, so the dose is doubled. That's why. So we select the dose based on all of these things. Also, fexofenadine. Oh, by the way, levocetirizine is also ever so slightly more recommended for the same potential reason. But levocetirizine is Zizol, and it's very expensive. Zizol is the brand name. What's missing here is also fexofenadine. A lot of people make the mistake of thinking fexofenadine is better because it's really, really expensive. More expensive than Zizol. That's not true. It's no better, it's no worse. Another one that you need a prescription for in America, that in Canada you don't, is desloratadine. Or Clarinex is the brand name in America. Again, it's no better, no worse. Why does that one require a prescription? I don't know. Nobody knows. It's just the world we live in. Do sometimes doctors write prescriptions for Clarinex because they think, or because you want to go to the pharmacy and go through all of that because it makes you feel perhaps there's some placebo effect in that, potentially. There's nothing special about it. There's also a nasal spray that's a second generation antihistamine. Azelastine is what it's called. That one you put directly in your nose. That one helps. That one helps a lot. Now, that is the H1 receptor. That is the H1 receptor. Here is the H2 receptor. Famotidine. Now, histamine 2, that receptor regulates stomach acid secretion. This reduces stomach acid. It doesn't help with allergies. Famotidine H2 receptor. Here's another one. Tagamet or cimetidine. Not nearly as effective as famotidine. And also this has a weird side effect of gynecomastia. I do not like this. I like this. This is pretty much the only one anymore because nobody ever uses this. We used to have ranitidine or ranitidine. Got pulled off the market. There are no generations of the H2 blockers. This is pretty much all we have anymore. I think there might be a prescription one or two, but nobody ever uses it. Now, histamine receptor 3, we got nothing. And 4, we got nothing. Nobody knows what they do.